Healthcare is a team sport. There are very few situations where, as an individual or an individual organization, that you can have a meaningful impact. But when we're able to collaborate, we're able to accomplish so much more and send a very powerful message to the communities that we're working together to solve difficult problems. There were a number of important themes that we hope to highlight with this series. And if anything, what I hope that we saw is a theme of collaboration.
It's all about partnerships, it's all about building collaboration, and it's all about recognizing that we all have a responsibility to address these things within our respective city.
Philanthropy, to me, is not successful if we're not addressing health equity, because love of humankind means love of all humankind. Our goal is to seek out community members and beneficiaries, find out what it is that they need, and do our part to help heal the community around us. I think it's going to take private-public partnership across the board to elevate healthcare.
This is a huge challenge. The opportunity to find solutions is absolutely there.
What the health department and others are doing on trying to come up with initiatives, with strategies, with programs to meet these inequities, to try to address what we are seeing in the numbers. No one entity can do it alone. It's going to take all of us working together.
Even the big health care systems, they have to go together in the local culture with politicians, churches, people interested in community health, and try to bring about some societal change. I say we bring those institutions of healing like hospitals. We bring institutions like those that are nonprofits that want to see people in this city thrive, and we make the thriving stretch out beyond those in the center to reach those at the margins. COVID-19 was somewhat helpful for us in discovering anew some things maybe we had forgotten about along the way, like you should be paying attention to one another and those on the margins.
When something like COVID hits, it doesn't discriminate amongst members of the population, and it's going to take all of us to overcome something like that.
We saw partnerships across our community that we hadn't seen before. It provided opportunities for us to see how health equity really works in the communities that we serve, and where the opportunities to really elevate performance exist.
In Houston, we really have what we call a paradox of plenty. We have world-class healthcare assets, our hospitals, doctors, and things like that. But we have poor health outcomes. Those poor health outcomes are driven by a couple different factors. They're driven by lack of access to health care. For example, our uninsured rate in Houston is about 24.4% versus the national average, which is just a little over 8%. It's also driven by what we call non-medical determinants of health, things like lack of transportation, food insecurity, lack of good housing. And those non-medical determinants are almost as important as lack of access to health care.
And when you start talking about these health disparities, you have to overlay that with economic disparities that exist, housing disparities, workforce disparities. All of these things intersect.
It's really important at St. Luke's that we're collaborating with our community partners to ensure that we're not only opening the door to whoever can get there, but we're helping others get there who might not otherwise find their way on their own.
Health equity is vital to our society, but it only can happen through partnerships such as San Jose Clinic and St. Luke's Health. At San Jose Clinic, the majority of our population is Hispanic, so most of our staff individuals all speak Spanish, and so they're able to assist with that barrier so that the patient will feel comfortable explaining their needs to the care provider at that time. It is our goal to not only provide a quality care for everyone, but also to try to meet their needs, whether it be mental, physical, but actually even spiritual.
As we move forward, we've got to do a better job of providing preventative care to the communities that need us the most. Our healthcare systems are designed to provide excellent care when you're sick. We've not really designed our healthcare systems to project preventative care to the communities that need us the most.
It is essential for overall well-being to be able to take preventative measures, to oral health promotion, anything in general to help manage any kind of chronic disease states.
The cost of treating many diseases on the back end or through an emergency room visit are significantly more costly, not only to the individual, but to our entire population. We need to look at investments that hospitals, public policy that cities and government are making, and the impact it has on our community. We must invest in media outreach and other services to make sure we are speaking to our community through people who are trusted entities.
We know wearing masks helps prevent the spread of COVID-19.
To make sure that they receive these critical messages.
And that's where some of the partnerships occurred during the pandemic that I think people were most benefited by. Our ability to partner with groups like Texas Southern University to provide access to vaccinations was an incredibly important opportunity for the communities that we were able to reach into. But also it established relationships that will last far past the pandemic and into the future. And we will build on those relationships in some new and innovative ways.
Mayor, I'm going to turn it over to you.
Our partnerships with our public officials was, I think, a really important part of the overall equation, as we're able to translate complicated clinical information to our elected officials and put them in the best position to communicate complex and rapidly evolving clinical problems to the communities. They guided our community in a time that was incredibly stressful, incredibly complicated, and they did it with a lot of grace.
We can do anything here in Houston if we just try and put our minds to it.
Partnering with public entities, private entities, and the community is absolutely key to finding solutions.
Houston has a history of solving problems through public-private partnerships by having government with business and community leaders work together to address difficult problems. And we've done that over and over again throughout the 200-year history of our city. And I think solving health equity will take that same sort of community leadership in order to address this problem.
It is essential for us to be able to collaborate and have these partnerships so that we can fulfill our mission.
The work that's occurring in and around Houston truly is special. The people that provide that care are passionate about taking great care of our community.
Healthcare should not be a partisan issue. It's a human rights issue. Just the fact that we are having this conversation is important while we are discussing these issues and providing information. I think that will help to move the needle.
I so appreciate partnerships like the one between Houston Public Media and St. Luke's to put together docuseries like this. It's the best way to inform the public about what's going on in an unbiased fashion. You can get an annual report from a place that's going to be really glossy and beautiful, but what we want to do is tell a transparent story about what's going on. And so I can't tell you how much I appreciate being able to do this with you guys in partnership. It's been wonderful.